As the leaves begin to fall from the trees and the sunlight becomes elusive, over 10 million Americans begin to feel the effect of seasonal affective disorder, according to Paula Ford Martin and David Edward Newton. While for some, winter brings along the promise of snow and fun, for others it brings along the dread of less sunlight, gray skies, and colder weather. Winter can bring the feelings of exhaustion and depression to up to 6% of our population. While the cause of SAD is not explicitly known, one cause is thought to be the decrease of sunlight during the winter months. While there are a few different treatments for SAD, the least invasive and seemingly most effective is light therapy. Today, I will inform you on the use of light therapy to help combat seasonal affective disorder. First, I will discuss the cause of SAD and its effects. Then, I will share the benefits of light therapy. And finally, I will highlight the effectiveness of light therapy when used habitually. To start, we must truly understand the causes of seasonal affective disorder and its detrimental effects. According to the American Psychiatric Association, SAD is not an official category of mental illness. However, it does affect over 10 million Americans. There are quite a few hypotheses on what causes SAD, one being an excess of melatonin. Our bodies naturally produce melatonin. It is what helps us sleep at night. However, as Paula Ford Martin and David Edward Newton state, researchers believe there may be an increase of melatonin in our bodies during the winter months. This is what could cause those affected by SAD to feel exhausted or depressed. Another thought as to why SAD affects so many people is that our internal clocks get out of whack due to the lack of sunlight. This interruption to our internal clocks could change the release of melatonin. An increase of melatonin could be the cause of some of the symptoms of SAD. Some of the symptoms associated with SAD are exhaustion, irritability, weight gain, and becoming withdrawn. These symptoms can cause serious issues for those who are affected by them, such as job loss, relationship problems, and so much more. If you are someone who is affected by seasonal affective disorder or know someone who is, you may have heard of light therapy. Light therapy is the first approach that most people suffering from SAD seem to take. It is less invasive and has fewer side effects than some of the other solutions. The use of light therapy exposes the patient to bright artificial light to compensate for the gloominess of winter, says Wineclaw and Davidson. It is recommended that a patient sit in front of a light therapy device for about 30 to 60 minutes a day. Using a light with the bright light intensity of 2,500 to 10,000 lux has become common. 10,000 lux is similar to the intensity of a summer day. Some studies have found that it is beneficial to receive light therapy around the same time each day and soon after waking up. A recent study has shown that there may be even more benefits from receiving a light therapy treatment prior to waking up and using a treatment called dawn stimulation. Dawn stimulation is a form of light therapy, but uses a gradual, gentle light as opposed to a bright light. You can also be sleeping while dawn stimulation is occurring. Dawn stimulation would occur an hour or so before you would wake up, and may be even more effective than traditional light therapy. Using light therapy prior to depressive episodes or right before you feel a depressive episode come on may increase your chance of postponing the next episode. Light therapy is seen to be more effective when used habitually. Whether this means you begin to use it during the fall months before you even feel the effects of SAD, or immediately after feeling a depressive episode come on. If you or someone you know suffers from SAD, getting into a routine with light therapy may be the best method. Starting to use light therapy prior to the winter months and continuing through early spring may help decrease depressive episodes. It is suggested to use light therapy for about 30 to 60 minutes a day upon waking up. Some people find they only need 30 minutes in front of the light once a day, while others may find an hour 2 times a day works best for them. Increasing use as needed and continuing the light therapy has proven to be effective. According to Meesters and Goergen, the effects of 2 weeks of light therapy were reported to be superior to those of 1 week. Knowing what method works best for you may take some time to figure out, but the results may be worth it. The winter months can be difficult for many. Decreased sunlight, harsher weather, and flu season can cause many to feel down. Using light therapy could be beneficial for many, even if they just think they are experiencing the winter blues. In conclusion, we have discussed the cause and effect of seasonal affective disorder, along with the treatment of SAD. Over 10 million of the American population is affected by SAD. Many would benefit from habitually using light therapy. I hope that in the future, light therapy will become more mainstream, and people will be able to treat their winter blues that may in fact be seasonal affective disorder.